Now, I said I would kind of explain the connection with chiropractic. So Palmer, the guy who started chiropractics, he wrote about taking an osteopathic course about 5 years after he took it. He went to Kirksville, where the first school was, and he took a brief course on osteopathy. He didn't do the full schooling to become an osteopath. And a few years later, when he wrote about his experience, he said that in that course he got all that he ever wanted or needed to get himself set straight on how to address the body. But he actually made a mistake. So when Andrew Taylor Still, the founder of osteopathy, would demonstrate treatments in front of crowds, he would take, at first, what we call an indirect approach. And this is really good because this is an important concept that's really at the heart of what makes osteopathy different. So I need to define an indirect approach and direct approach before I can finish the story. And it depends upon a joint's motion. So I was going to use this pen, but I've got my neck, so let's use that. Let's say that I got punched from this side. So all of the elements that would restrict left rotation get stretched quickly. And if it's my jaw, well, even the capsule in my jaw gets stretched. So after that, the balance of tension in the ligaments will be different because they were all stretched out going this way. So before that injury, maybe my neutral was right in the middle. After that injury, when I'm relaxed, the head would want to move this way and the jaw would want to deviate that way because of the way the force changed the tensile strength of those ligaments and tendons. So direct technique is where we oppose the barrier. So if the head wants to move this way, it's hard to move that way, and there'll be a point where there's a barrier, where there's increasing resistance. But it's easy to move that way. There'll still be a barrier over here, but it will be a normal physiologic barrier. Here there'll be a pathologic barrier from the injury. So if the practitioner is moving the structure through the restrictive barrier where it doesn't want to go, we call that a direct technique. If the practitioner is moving away from the barrier towards balance, or is exaggerating the asymmetry, we call that an indirect technique. So historically, chiropractics used exclusively direct techniques, with which in osteopathy we call high velocity, low amplitude. And in that technique, which osteopaths learn as well, what we do is we put a joint, we disengage the tension in one plane of motion. So let's take this for instance with my neck. Let's say, I got hit, so I wanted to go, let's say it went kind of like this way. So I'm wanting to side bend and rotate left. So if I was going to treat that with high velocity, I could side bend left, and then I could rotate the neck to the right. So then I would free up the articular component of a restriction in rotation. That'd be addressing the barrier. So I bring it up to that bony feeling restriction in the joint, where the joint surfaces have become compressed together and the synovium has thinned out because of that compression. And then I make it move through that. I snap the adherence of the viscous synovium so that the joint can open back up and get more synovial fluid between it. And that's cool when it works. But we all know stories of people who get popped every week for a year, for 2 years, for 3 years, or every month or whatever. And if they don't get popped that next week or that next month, they feel the same as they did when they first started. And that's because that approach doesn't always address the cause of the synovium being thinned and the joint being compressed together. Because the cause usually lives in the ligaments and the fascia. Sometimes the muscles are an important part, but usually the muscles are reactive. So usually treating a muscular symptom, we're treating a consequence of a deeper dysfunction. And the same thing when we're just treating an articular restriction. So if it's not the cause, you could pop it every day, every week, and the person stays in the same place if they don't get it popped again. If it's the cause, you only need to pop it once or twice. And I've had this experience personally with my subtalar joint, my talar calcaneal junction, and have had this experience with patients as well. When you select the technique to match the dysfunction, you see improvement. You see decreasing reliance on the provider. And that is the status quo for a good osteopath. We don't typically sell packages because we don't plan for people to need us continually for a long period of time. Relatively quickly, people should start feeling better and need us less and less frequently. There's some exceptions with significant anatomical changes. There may be some people who really still get benefit from getting treated weekly or monthly. But generally, the reliance upon the osteopath decreases with time.